Thank you for joining me today for our talk through the disability basics. I want to start off by thanking the American Migraine Foundation for allowing me the opportunity to talk about Social Security disability today. And this is the third and final installment of our patient access joint partner series for Facebook Live through the American Migraine Foundation. And today, like I mentioned, we'll be discussing Social Security disability basics. I know migraine disease can be, as well as other headache disorders, can be incredibly debilitating and can definitely impact your ability to work. It can be very difficult due to nausea, auras you might have, light sensitivity, not to mention the severe pain that you go through while having a migraine attack. So today we're just going to outline the basics of Social Security disability, how to apply for disability, some challenges that patients with headache diseases face while going through the application process, as well as some application tips. My name is Emily Brown. I am the Patient Education Content and Project Manager for Patient Advocate Foundation. PAF is a national nonprofit organization. We are a 501c3 that was started in 1996. And we offer case management services as well as financial aid to Americans who have chronic and critical illness. And since we were founded in 1996, we have served over 1.3 million people, and we've helped them along the process of navigating healthcare and healthcare issues they face. So I have been with PAF for 6.5 years, and 5 of those years I worked as a case manager, working one-on-one with patients who have chronic and critical illness. And I worked with them to navigate healthcare challenges, to help find solutions to pay for care, and as well as really just navigate life and finances after diagnosis. So I know a bit about the disability programs, and I'm hoping to share a little bit of that knowledge with you today. So just a little disclaimer before we dive in further. There are several different types of disability programs that are available, including short and long-term disability programs, temporary disability, state disability. We're not going to be talking about any of that today just because there is such a variation and such a range in those programs. So we're going to be strictly focusing on Social Security disability and how to manage that process. So we'll just go ahead and jump into the topic. First, we want to answer the question, what is Social Security disability? Just for anybody that may be unsure or unfamiliar with the topic. So the U.S. federal government, more specifically the Social Security Administration, whom moving forward I'll just refer to them as SSA, they are the ones that oversee and administer the Social Security programs for the U.S. There are 2 separate and very unique disability programs for people who have lost the ability to work due to an injury or a severe illness. Disability acts as an economic safety net for people who are unable to work but obviously still need to manage daily expenses, monthly bills, and Social Security disability provides monthly benefit payments to those folks who do need that because they're unable to work. So the first disability program we're going to jump into and talk about today is SSDI. It is Social Security Disability Insurance. And SSDI is a program for folks who have worked and paid FICA taxes into the Social Security Trust Fund for years prior to becoming disabled. And there are no resource or asset limits that are required or that are on the SSDI program. And generally speaking, you will have needed to work 5 out of the last 10 years to be eligible for the SSDI program. Based on the time you have worked, you earn what's called work credits. And the number of work credits that you need to be eligible for SSDI depends on when you became disabled. That SSDI payments are calculated based on the amount that you've paid into the system. And for 2020, the maximum allowance for your monthly benefit is $3,011. And so that payment actually changes annually, just depending on inflation and other factors. But for 2020, that number, the maximum amount you can get through SSDI is $3,011. There is a waiting period to get benefits, and you will wait 6 months typically from the date that SSA deems you disabled before your monthly payments will start. There is an insurance component with both disability programs. With SSDI comes Medicare. SSDI is the program that we'll focus more on today, but I do want to touch a little bit on the other program just so you have a sense of what the differences are. So the second disability program that SSA administers and oversees is SSI. It is Social Security Income. SSI is the same in terms of what medical criteria must be met in order to be disabled. However, the difference in the two programs is that SSI is a needs-based program. So SSI is going to be for folks who have not worked enough or worked jobs that paid into the Social Security system. So typically it is very different from SSDI in that fact, and it is just designed for those folks who have not paid those FICA taxes into SSDI like the other program. And this is different as well because there are income and asset guidelines for SSI. Your countable resources cannot be higher than $2,000 for an individual or $3,000 for a couple. And some of the countable resources that are looked at are things like your home. Do you have, outside of the home that you live in, do you have other vacation properties? Do you have rental properties that you get income from? They look at how many cars you have in your household. They look at do you have additional money anywhere in, say, a savings account or an an investment account. So those are the kinds of things that they're looking at when they look at countable resources. Because SSI is a needs-based program and is designed for people who have not worked or paid in enough to the Social Security Disability Program, there is one flat benefit amount that is given per month for those folks that are on SSI. For 2020, that amount is $783. And again, just like SSDI, that maximum amount is changed annually depending on inflation and other factors. There is no waiting period for SSI like there is for SSDI. So you will start to receive, if you're approved for SSI, you will start to receive your benefits the month you are approved and you are deemed disabled and eligible for that program. And as I mentioned, there is an insurance component for both programs. So for SSI, it is a qualifier for Medicaid. So as we talked about before, Medicare goes along with SSDI, but again, very different program for SSI, and SSI comes with Medicaid. So it can get a little tricky. They sound very similar, but they are very different programs. In most states, when you are approved for SSI, you automatically get Medicaid. However, there are certain states, I believe there's 10 states in the U.S. that have stricter guidelines than what SSI limits. So whether that's categorically or financially. So in those states, the people that are eligible for SSI have to do separate applications to be eligible for Medicaid. And if you live in one of those states, the SSA program or the local office there will be able to tell you if you have to do a separate application based on your SSI approval. So now that we know a little bit more about those two programs, let's move into how SSA determines who is eligible for disability and who will get those monthly payments. So Social Security pays only for total disability. So none of the temporary, no short-term disability, no partial disability. And they qualify total disability as not being able to work for 12 months or more. As I quickly mentioned earlier, some states have their own short-term or temporary disability programs. I think California, New Jersey are a couple. There are, I believe, 3 or 4 others that have those temporary programs, but that is state-based and not related at all to the Social Security benefits that we're discussing. Just a quick side note. So total disability can be related to any physical or mental impairment that can be medically verified, and that's an important thing to remember. Something that's important to remember as well is that SSA looks at disability in terms of the totality of your impairments. So one diagnosis alone may not be enough in Social Security's eyes to deem you disabled. However, if you have multiple diagnoses, that may be enough to be able to make you eligible to receive benefits. And I know there are several comorbid conditions that often come along with migraine disease. So those conditions together could potentially be able to get you a disability approval. So SSI determines or defines disability if you cannot do the work that you did before you became injured or sick, and you also can't adjust to other work. Or if your medical diagnosis is severe enough that it is expected to or has already lasted 12 months, or is expected to result in death. And in order to determine whether someone meets the definition of disability or the guidelines for disability, SSA uses what's called a disability impairment listing. Also, it's sometimes referred to as a blue book listing. That is basically the medical criteria that helps the disability examiner evaluate the impairment. At this time, migraine disease does not have a blue book listing. So, what does that mean? Basically, it means that there's not a set of criteria that determines disability for migraine or headache disease. However, it does not mean that you are not disabled. It doesn't mean that you will never get Social Security disability. All it means is that the Social Security examiner has to go about your case in a little bit different way and handle your claim a little differently. So how do you apply if you're interested? So there are 3 ways to apply. One is by calling the National Social Security Hotline, and that number is 800-772-1213. That line is available, I believe, 7 a.m. to 7 p.m. Eastern, Monday through Friday. The other way to apply for disability, or another way I should say, is by going into your local office. And if you're not sure where you should go, on the SSA website, there is a really nice office locator where you can put in your zip code and then it tells you the closest office to you and the one that you should be using to kind of coordinate with. The third and most popular way to apply for disability is through the website. So you can do an online application at ssa.gov. I will give a quick tip on this. Be very careful that the application and the website you are using is in fact ssa.gov. There was a scam, if you want to call it that, going around a while back where attorneys were sort of mocking up their websites to look very similar to the ssa.gov website and linking out to the disability application from their site. So when people were approved for disability using the link that was provided through their website, they were able to claim that they were representing those patients or those claimants, and therefore they were able to get a chunk of the award that was given when those folks were approved. So just be cautious, not to deter you at all, because I think most of the time the online applications are the easiest way to go, because you're able to start and stop the application whenever you need to. If you're having a bad day, you can save and go back in later if you need to. Another nice thing is that even if you start an application online or over the phone, really however you start an application, you have to actually complete an interview to finalize your application as well as present documents. Typically this is done in person, but if you are having a rough day or if you are in the middle of a migraine attack, you can opt for a telephone interview. And another quick tip on this is that you can schedule an interview before you even do the application. And this is a great way to save time. So if you don't do it that way, you have to complete the application and then wait on Social Security to schedule your interview and then mail you a letter telling you when your interview is. So if you go ahead and call Social Security, your local office, set up an interview, you can actually complete the application in the meantime before your interview takes place. So that'll kind of get things going a little faster. Getting into the application, I just want to quickly go through some of the things you'll have to provide for the application. One of the things that's necessary and that they ask for on the disability application is the dates of employment that you worked for your past jobs, as well as what you did at those jobs. They will ask for the names, addresses, and phone numbers of any medical provider that you've seen for the condition that you're claiming your disability for. So any doctor, hospital, clinic that you've seen related to your headache disease, you'll have to provide that, as well as not visits for any hospital that you've had, the dates of those. You'll also need to provide the names and dosages for any medications that you take. You'll need the full name and Social Security numbers for anybody who lives in your household. You will need medical records from, again, any of those providers that have seen you or treated you in relation to the diagnosis you're claiming disability for. There's a lot more you'll need to provide with the application, but those are just a few quick things that you'll need to provide. Want to go through a few tips on actually completing the application. So my first tip is to gather your medical records yourself. That you'll have to provide medical records as part of the application. You can sign a form to allow SSA to collect those records for you, but if you provide them at the time of application, that is going to expedite things a lot. You'll be able to provide all those documents to the medical examiner or to your disability examiner, and that will save them time and a lot of effort, because any doctor, hospital, clinic, any practitioner or provider that you've seen related to your headache disease, the disability examiner is going to have to contact each individual office or hospital or clinic and get those records. So if you can provide them up front, that is going to really save some time. A little sub tip to that: be sure that the records you're providing the disability examiner are your complete record. And I mean, don't just go on your online patient portal for your doctor's office or the hospital you go to and just download your records off of there. You would want the actual medical records from your visits, just because sometimes the online portals don't give you the full record, and you're going to want to make sure you're painting the complete picture of your situation. Another tip I'll provide is do not diminish your pain or symptoms on the application or in the interview. The more honest you are about how disabling your condition is and how it affects not only your ability to work, but also just your daily life, the better your chance of approval is going to be. There are a lot of parts of migraine that make it difficult to be in a work setting or a traditional business environment, and you will want to list those out and make sure that the disability examiner understands how you struggle to be in an environment that has a lot of strong smells or bright lights, or you may have trouble concentrating, or you may have memory loss when you have an attack, or your speech may be affected when you're in the middle of a migraine attack. So there's a lot of different things that affect your ability to work and be productive when you're in the middle of a migraine episode. So be sure that you are making that clear in your application as well as in the interview. Always list your medical conditions, all of them, whether they are mental or physical. So as I mentioned previously, it's the combination of all of your diagnoses, the totality of your conditions, that actually makes someone disabled. And it helps to support your claim of being disabled. If you experience depression, anxiety, any other kind of comorbid mental health condition, in addition to migraine or headache disease, be sure that you're listing that on your application. Remember to list any side effects that come along with medications that you're taking that could impact your ability to be productive or to work in a traditional setting. The last tip I'll provide is to educate your disability examiner on what migraine is. Disability examiners are busy people, and they are responsible for thousands of applications, and they see thousands of diagnoses all the time. So they can't be expected to be experts on every diagnosis. So it's your job to provide your disability examiner with validated, good, just trusted information about migraine disease. And that can go a long way to help those examiners understand what you go through every day when you are dealing with your migraine disease. So I wanted to briefly touch on some challenges that people with migraine disease might face in terms of being approved for disability. So the first is just stigma in general and a historical misunderstanding of what migraine is. And that can make approvals difficult if there's preconceived ideas about what migraine disease is. And I'm sure a lot of people face that on a daily basis in their normal lives. This is no different. You'll want to provide information about what migraine is, and that's just a whole nother reason why it's so important to educate your examiner on migraine disease and how it affects you personally and professionally. Secondly, your doctor may not support your claim for disability. And if that is the case, you need to seek another provider who will support your claim. One of the most important things with a disability application is just having your doctor's support and having documentation in the medical record of how disability affects you on a daily basis and affects your ability to work. So, in addition to the evidence that your doctor will provide, Social Security is going to expect to see physician's notes about the severity and the frequency of your attacks, the results of any treatments that you've tried, as well, medical treatments as well as holistic treatments that you've tried, as well as I've mentioned, records. And the more you're able to document your migraines through just diary tracking that you do, or any kind of app data that you put in when you are tracking your symptoms and your severity and your auras and all of that, really just the better your chances will be. So once your application is submitted and your documents are all in, the typical time frame for a decision is going to be 3 to 5 months. Since it is not a quick process, really the earlier the better when getting your application in. It's best to apply at your first opportunity, just due to the fact that there's such a significant time frame between when you put your application in and when you actually receive a decision. So another important thing, and this is my last big thing I'll note, is Social Security disability benefits do not have to be permanent. So I know that there's a lot going on in the headache community these days. There's a lot of new treatments, both preventative and acute treatments. And a lot of people are finding relief where they previously didn't have relief or didn't have hope for relief. So if you are approved, or if you're already on disability benefits, and one of these new treatments or something else you try, your condition changes, you don't have to stay on disability benefits. Social Security and SSA have programs to kind of let you ease back into work, kind of test the waters and see how things go, and kind of let you readjust to the workforce slowly, and then potentially come off of disability benefits. So that's a lot. Disability is a big topic, and really I've just scratched the surface. We do have, Patient Advocate Foundation does have a couple of webinars that we've produced regarding Social Security disability benefits, talking more in detail about the application process, more about back pay, more about what to do if you're denied and how to go through the Social Security disability appeals process. So all of that is available on our Migraine Matters tool on our website. So that's patientadvocate.org/migraine matters. You'll be able to find those webinars there, as well as a lot of other great material. And additionally, Patient Advocate Foundation has a team of case managers that work specifically with patients on getting disability benefits. So if you would like one-on-one assistance, we do have staff here for free who are able to assist you with that process, and at least even if you don't want hands-on assistance, at least point you in the right direction. And you can contact our migraine care line at 866-688-3625. Or you can go to migraine.pafcareline.org if you need that one-on-one assistance.